Yeah.
I can't do that.
Okay. So, continue on with the lower limb. We just got a few slides for today, and then we can all take a weekend. Yay. That sounds perfect to me. Okay, so, next section we're talking about is the popliteal fossa. Remember, it's a area on the backside of the knee joint where we have neurovasculature close to the surface. So basically, the area is covered by the superficial fascia and the skin, and right under that is where we have all of these nerves and vessels coming through. Excuse me. Okay. The borders are formed by the muscles of the posterior compartment of the thigh and the posterior compartment of the leg. So we have the semitendinosus and semimembranosus muscles forming the medial, superior medial portion of the wall. So this is medial, lateral. The other half of the superior border is the biceps femoris. And then the lower border is by the two heads, the medial and lateral heads of the gastrocnemius. Okay, and then through the popliteal fossa, we have running the popliteal vein and artery. Remember, those are the continuations of the femoral vein and artery. And then the tibial nerve. Branching off of the sciatic nerve as it becomes the tibial nerve is also the common fibular nerve that kind of skirts along the border of the popliteal fossa. Excuse me. Okay. All right, and then I'll just point out that the small saphenous vein, remember, comes up the midline of the posterior part of the leg and dives deep at the popliteal fossa to join with the popliteal vein. Yep, so the small saphenous vein dives deep at the popliteal fossa through this superficial fascial layer and joins with the popliteal vein. That is all we need to know about the popliteal fossa. The end. Okay. So then let's move to the leg, the next lower part of the lower limb. And I'll just remind you that we've got 3 different compartments of this the part of the leg. So anterior compartment and the posterior compartments. And those are separated by the tibia and fibula and the interosseous membrane that goes between them. So that's the border between the anterior and posterior. And then we have a small lateral compartment. And remember what the compartments do. What does the anterior compartment do? Dorsiflexion of the foot. Yeah, so when we're talking about the leg, most of the muscle activity is going to be affecting the positioning of the foot. So it's affecting the ankle joint. So dorsiflexion of the foot. What about posterior? Plantarflexion of the foot, yeah. And then the lateral eversion of the foot, yeah. And then there are others that are doing some extension or flexion of the knee. We have like the gastrocnemius also participates in flexion of the knee, but the majority of the muscles are working on the ankle joint, positioning of the foot. Okay, so then just look at the interosseous membrane here. So it's the separating or connecting the fibula and the tibia. Remember, it's a thick, tough sheet of fibrous cartilage. Oh, there's no D in cartilage, I don't think. And then this is a particular type of solid joint. So remember what kind of solid joint it is? Yeah. Syndesmosis type joint. Okay. Just point out that there are apertures at the superior and inferior ends of the interosseous muscle. These are important for blood vessels moving from the posterior compartment into the anterior compartment, especially here with the superior aperture. Okay, so then there's just 3 features I want you to know on the tibia and fibula for, excuse me, for this section. So we have the soleal line here. That's that ridge that kind of moves upwards and laterally on the posterior surface. And this is important because it's one of the major attachment points for the soleus muscle, one of the major muscles of the leg. And then the lateral malleolus and medial malleolus, those protrusions on the fibula. So the lateral malleolus is protrusion on the fibula, medial malleolus protrusion on the tibia. Good landmarks for palpating, you know where you're at. Okay. All right, so that's bony structure, muscles. For the posterior compartment, we have the most superficial is obviously the gastrocnemius, and then we have the soleus. Those are our 2 major muscles. Gastrocnemius attaches to the posterior surface of the distal femur, just at and above the femoral condyles, and so this is why it can participate in knee flexion. The 2 muscles then come together and continue on as the calcaneal tendon, which attaches to the posterior surface of the calcaneus. And anybody know what nerve innervates these guys? I can't. Correction. Tibial. Yep. Tibial nerve. So tibial nerve innervates the posterior compartment. Okay. We also have an additional superficial, whoa, too far. Yeah, superficial muscle, the plantaris, and it also attaches to the posterior part of the femur on the lateral side, and then comes down with a super long tendon, so it's mostly tendon, and that fuses then with the calcaneal tendon. The reason I bring this one up is they often will harvest this tendon in people that have that muscle. So not everybody has this muscle, but in people that do have this muscle and they're doing like knee surgery and they need extra ligament type tissue, they'll actually take that tendon out, chop it up, and put it in place of the ligaments.
What tendon?
The tendon of the plantaris muscle. Yeah, so this tendon right here, it's super long.
You said not everyone has this?
Right, yeah, not everyone has it, so we don't really need it, so you can take it out and use it for other things if you needed to. Okay. So then those are the superficial muscles of the posterior compartment. We also have some deep muscles I want you to be aware of. We have the tibialis posterior. And it's involved in plantar flexion of the foot and also inversion of the foot. And then we have these two here, the flexor digitorum longus and the flexor hallucis longus. See if I can stumble over those. Yeah? What do we need?
It's inversion, right? For tibialis posterior.
Yes,
Like
inversion. Mm-hmm. Any other? We good to go? Okay, so And then these two muscles here, what is their purpose? Flex the digits, flex the digits. And so these flexor digitorum longus is for toes 2 through 5. And the hallucis, flexor hallucis longus is for the great toe. Yeah. You can see where their tendon, so the tendon of the flexor hallucis longus kind of just goes straight to that distal phalanx of the big toe, and then we have the splitting of the flexor digitorum longus for the rest of the toes. Okay, so those are the posterior muscles, deep posterior muscles of the thigh, leg, whatever we're talking about. Oh my goodness, I'm glad when I have my brain back. Okay, so major arteries of posterior compartment. Remember, we're continuing on with the popliteal artery. That then divides, excuse me, into the posterior tibial artery here. That continues onward down through most of the rest of the posterior compartment. We have an anterior tibial artery that passes through that aperture in the osseous membrane, wraps in around to the front of the leg and supplies the anterior compartment. Posterior compartment. And then we finally have the fibular artery here, which supplies the lateral compartment and lateral parts of the posterior compartment. So we'll just stick with lateral. Okay.
Where does that branch off of?
It branches off the posterior tibial artery. Yeah, so the once the anterior tibial artery branches off, then the rest of the arteries becomes the posterior tibial artery.
Can you say that one more time? So the
Yep.
popliteal artery
Yep.
branches into the posterior and the anterior?
Tibial arteries.
Tibial arteries.
Yeah, and then the fibular artery probably branches off the posterior tibial artery.
Okay.
Yeah. Okay. All right, we good? Okay, nerves of the posterior compartment. So because it's the leg, we are talking solely about branches of the sciatic nerve. So remember, it's the sciatic nerve splits just above the knee joint into the tibial nerve and the common fibular nerve. The tibial nerve innervates the posterior compartment, and it sends off a branch, the sural nerve, I just wanted to mention that one, that moves superficially and is the nerve that innervates the superficial structures of the posterior and lateral part of the leg. And then the common fibular nerve wraps around the head of the fibula and innervates the lateral and anterior compartments of the leg. So, posterior compartment, anterior and lateral compartments. So here's just an image showing the sural nerve coming up, penetrating the deep fascia to move into the superficial areas and coming out to innervate the lateral, posterior and lateral parts of the superficial leg. Okay? Make sense? Any questions? That is it. Have a fabulous weekend.
Me too.
Thank you. I'm going to sleep. block.
I think, yeah. Well, as you also. Ambient.